Well, good morning, everyone, and thank you so much for joining us. My name is Katie Baker, and I am the State Director for Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one, in which we engage with press and the public. I want to thank Congressman Bobby Scott for helping us organize this press call today, as well as all the members of Virginia's delegation who were able to join. Just very grateful for their leadership and for all being healthcare champions as we come together today to talk about the importance of renewing the enhanced premium tax credits to keep insurance affordable for as many Virginians as we can. And without action from Congress, Virginians could see who buy their health insurance on the exchange could see their premiums going up by hundreds of dollars a month. And those notices are going to start hitting mailboxes next month, which is why it's so pressing that we're having this call here today. And just to keep my remarks really brief, since I want to let our members of Congress really speak to the matter at hand, I just wanted to share a personal story. My uncle lives in North Carolina. He is a self-employed electrician who buys his health insurance on through the Affordable Care Act marketplace. And I just saw him this weekend. He said that his insurance is set to double. His premiums are set to double. He's not quite old enough to qualify for Medicare. So that's why it's so important that we are sharing our own stories and really making sure that our colleagues across the aisle understand the importance of renewing these enhanced premium tax credits. And with that, I want to turn it over to a storyteller who's going to share her own personal story of why the Affordable Care Act is so important to her, Laura Packard.
Thanks for inviting me, Katie, and thanks for everyone for being here. My name is Laura Packard, and I'm a small business owner in Alexandria. And thank you to my Congressman Don Beyer for being here. And I'm here because the Affordable Care Act saved my life. 8 years ago, I was diagnosed with stage 4 cancer, but thankfully, I had good insurance through the Affordable Care Act that paid for the 6 months of chemotherapy and month of radiation treatments it took for me to be in remission today. And that's the good news. The bad news is the day after my first chemotherapy appointment, Republicans in the US House voted to repeal the insurance that was keeping me alive. And now, 8 years later, they're at it again. They're coming at our health insurance. And I am one of the millions of Americans that is terrified of opening the mailbox and getting the sheet of paper that says what my premiums will be next year because as a cancer survivor, I have to pay it. I cannot go without health insurance. So whatever they charge me is what I have to pay. And if I get no help with paying for it, then I have to decide how I'm going to somehow pay for this health insurance. So millions of people are going to be going through this right now, and lives are at stake. So, Republicans in Congress need to do the right thing and extend the tax subsidies now.
Thank you so much, Laura, for joining us. And next, we will have Congressman Bobby Scott. Congressman.
Thank you. Thank you, Katie, and thank you, Laura. And we look forward to hearing Lester in a few minutes for telling your stories. And thank you to Protect Our Care Virginia for hosting this important call. We're here to discuss the ongoing Trump Republican healthcare disaster, and we must stop the upcoming Republican hikes, premium hikes, by making the existing Affordable Care Act enhanced premium tax credits permanent. Without action from Congress, enhanced premium tax credits will expire at the end of this year, and healthcare costs will increase for more than 326,000 Virginians, and many will face unaffordable premium increases. And we just heard from Laura, those that are sick will pay the higher prices. Those that are healthy might drop out, which means that the insurance pool will be sicker and they'll have to charge higher prices. Thanks to the ACA, over 40 million Americans now have affordable health coverage, and no one can be denied coverage for a pre-existing medical condition Young people can stay on their family policies until they're 26, and there are a lot of other benefits with the Affordable Care Act. The American Rescue Plan Act reduced health care costs for working families receiving coverage through the Affordable Care Act, and then we locked in those savings with the Inflation Reduction Act. Last week, the Congressional Budget Office released a new analysis of the harm caused by Republicans' relentless attacks on health care, including their repeated attacks on the Affordable Care Act. These policies will lead to dramatic premium spikes and coverage losses for millions of Americans. Failure to extend the ACA tax credits will cause about 3.5 million Americans to lose their health insurance and increase premiums for over 20 million Americans who buy coverage on the ACA marketplace. Making matters worse, early this year, the Republicans enacted their big ugly law, which included healthcare cuts that will leave a total of roughly 15 million people without health insurance by 2034. As a result of these cuts, 3 rural health clinics in Virginia have already announced that they'll be closing as a direct result of those cuts. And everyone is affected because the cost of the people who lose their coverage and get sick will be shifted to those with insurance who will see their premiums increase. The Medicaid cuts from the big ugly law and the expiration of the ACA's enhanced premiums will increase the number of uninsured Americans in every congressional district in the nation. In Virginia alone, about 350,000 additional people will lose health insurance by 2034 because of these new policies. And all of us on this Zoom today are united in reversing these harmful policies. So thank you, Lester and Laura, for sharing your personal stories on how that's going to happen and the effect of these cuts. And I want to thank all of my Democratic colleagues for joining me in this fight to protect our care to lower costs for Virginia's working families. So thank you, and back to you, Katie.
Thank you so much, Congressman. And next, we will have Congressman Suhas Subramanian. Congressman.
Thank you. I want to thank all the organizers for putting this together and thank my fellow Democrats in our delegation for being here today. I think it's very plain and simple. This administration has initiated a full attack on people's ability to get affordable care. It started at the very beginning of this administration when they started firing health professionals and healthcare experts, and then they started cutting critical programs at places like NIH, which serve to actually lower the costs of care and cure cancers and diseases. I brought a woman, Susan Perry, who lives in Fauquier County. Her son is on Medicaid. Her husband is a federal worker. She has a long-term illness as well. And this administration has done nothing but make her life worse. And so many Americans like Susan are feeling the pain of this administration. And so when people hear us talk about healthcare and why we're standing up for it, we're talking about people in our districts, Democrat and Republican, healthy and sick, rich or poor, it doesn't matter. Everyone is going to suffer because of this administration's firings of healthcare professionals and cuts to critical health programs. The Medicaid cuts don't just affect people on Medicaid, although we have hundreds of thousands of people in Virginia who will lose care because of it. But it also affects people not on Medicaid, because that means hospitals will have to charge more and premiums will go up for everyone. It will make care further and further away from reality. And it's only going to make people sicker. It's going to make healthcare more expensive. And we have to do something now. We cannot let this continue to spiral into a national crisis. And so that's why we're standing up right now. This is critical. This moment right now requires us to do more than just sit back and decide that business as usual and things are normal right now. Things are not normal. And so I know my colleagues agree with me, and that's why we are united in this fight to make sure that everyone has affordable care and that this administration doesn't continue to take away people's access to quality, affordable care. Thank you so much again for everyone joining.
Thank you so much, Congressman. And now we will have Congressman Don Beyer.
Thank you, Katie, and thanks, Laura and Lester, for sharing your stories today. And I'm Pleased and honored to be on with my wonderful Virginia colleagues. Look, healthcare is a top issue for all of us. It always has been. And making our healthcare system better and more affordable has got to be one of our biggest political challenges. And the greatest accomplishment of this century has been the Affordable Care Act. And the premium tax credits are an essential part of making that law work for Virginians right now. But earlier this year, when the Republicans passed their one big ugly bill, it failed to extend those tax credits. And that's going to raise healthcare costs for hundreds of thousands of Virginians. And that's on top of the law that has these reporting requirements for Medicaid and other cuts, which is going to take healthcare from millions of Republicans and drive up costs for millions more. The great irony is that so many of the people that are losing their health care and won't be able to afford their health care are living in districts represented by Republicans in Virginia right now. We also warn them that their bill threatens our rural hospitals. Again, overwhelmingly in the 7th and the 6th and the 5th. The cuts in the bill, especially the Medicaid cuts, are a huge problem for hospitals and health clinics, especially in rural areas where most of the population is on Medicaid. Earlier this month, our warnings were borne out when Augusta Healthcare announced that they would permanently close 3 health clinics in the Shenandoah Valley, in Buena Vista, in Churchville, and in Wyers Cave. Many in Augusta's position wouldn't do this, but they actually came out and said these closures were necessitated by the Republican bill. I don't represent the Shenandoah Valley right now, but I spent a lot of time there when I was running statewide 3 times. And I love the people. I thought the people there deserved to have their concerns raised since their own representatives weren't going to be on this call. Some patients of this clinic are going to be rerouted to providers. Nearby providers would be an exaggeration. They're going to have to come all the way to Manassas, to Loudoun, to Northern Virginia, to Richmond, far away, Hampton Roads. There's a big convenience on its own when you're particularly worried that many people just won't make the trip and their health care will suffer. They'll postpone, they'll delay, they'll get sicker and sicker. The Virginia Mercury wrote that 1 in 5 people in these districts are on Medicaid. It sounds about right. This bill is failing them, and not extending premium tax credits is just another blow to people in these communities. We're talking about these clinics in the Shenandoah right now. We're hoping that we have a Democratic governor soon to help make up that difference. But we know that other rural hospitals, in the Northern Neck, in the Middle Peninsula, and South Side, are facing similar economic pressures made worse by this bill. This is going to be a big problem across the country. Republicans made the mess. They need to work with us to fix it. Katie, thanks, and back to you.
Thank you so much, Congressman. And now we will have Congresswoman Jennifer McClellan.
Thank you, Katie. I represent a district that is rural, suburban, and urban. And as one of 2 Virginians on the Energy and Commerce Committee, I sat in a 26-hour hearing on the Big Ugly Bill as we saw our Republican colleagues claiming that they were just trying to make healthcare available for everyone and strengthen the system. Yet they did absolutely nothing to address the actual underlying costs and the reasons that costs are increasing for healthcare and just about everything else, from energy bills to groceries. They did nothing to fix that. Instead, they put draconian paperwork requirements in place that other states have proven will kick people off of their health insurance. They put cuts to Medicaid that will, as you've already heard, hurt our rural hospitals, but they'll also hurt our urban and suburban hospitals. I was a member of the state Senate when we expanded Medicaid, and I also carried the bill to create the Virginia Healthcare Exchange. And the reason we did both, just like the reason the Affordable Care Act was passed in the first place, was because we understood that costs go down when the uninsured rate goes down. The more people who have access to health insurance, the more likely they are to get the care they need before it's too late or before it is too expensive, to get the primary care and focus on wellness. And yet, with this bill, so many people will not be able to afford health insurance or will lose it altogether, over 15 million people. But they'll still get sick. And instead of going and getting their primary care or going when something first feels wrong, they'll show up in the emergency room when it may be too late and it's definitely more expensive to treat. And if they're uninsured and they can't pay that bill, the rest of us pay for it. But this bill also hurts our clinics. During the recess, I traveled not just in my district, but all across Virginia to talk to providers and patients about their fears. I visited a dental clinic out in Abingdon. Before this dental clinic opened, and 80% of their patients are on Medicaid, but before this dental clinic opened, people had to wait once a year for the RAM clinic in Wise County to come and get their basic dental needs. And yet, this clinic now is worried, how are they going to keep the doors open because of these cuts and because of people losing their insurance through both the Affordable Care Act because they can't afford it, and through the cuts to Medicaid. I want to point out one other thing. I sat in another hearing where Secretary of Health Robert Kennedy Jr. talked about everything that the administration wanted to do to make America healthy again. And I couldn't help but notice a huge disconnect between the words coming out of his mouth and the actions coming out of the Trump administration and congressional Republicans. Because it's not just stripping people of their health insurance, but it's stripping people of food assistance, the same population, in a way that not only impacts individuals and families, but impacts child nutrition programs and impacts rural grocery stores. And so we already had healthcare deserts and food deserts, and the big ugly bill is going to make that worse. And once the enhanced premium tax credits on the ACA expire, it's going to be even worse again. And so I join my Democratic colleagues. There is legislation pending from Democrats that would extend the premiums permanently, that would undo these draconian cuts to both SNAP and Medicaid, because people elected us to help them, to lower costs, to close healthcare deserts, to make sure that everyone, whether they are rural, urban, or suburban, no matter who they voted for, knows that if they get sick, they can get the care they need and not go bankrupt. And under the big ugly bill and congressional Republican inaction, that's not going to happen.
Thank you so much, Congresswoman. And now we will have Congressman James Walkinshaw. Congressman.
Well, thank you, Katie, and thank you to my colleagues for their wonderful comments. I'll start by just saying this fight for affordable health care is one that has defined my career. I was staff in 2009 and 2010, where we were fighting to pass the Affordable Care Act, and courageous Democrats like Bobby Scott and so many others delivered really historic reform that has helped millions of Americans access care. I watched congressional Republicans then do absolutely everything in their power to block hardworking Americans from getting access to affordable health care. And today, as a member of Congress, again, I'm watching congressional Republicans, now led by Donald Trump, doing absolutely everything in their power to block hardworking Americans from getting access to affordable health care. And I'll just make a couple of points that I think are important with respect to Virginia's 11th district. First of all, one of the challenges we face in Northern Virginia is the perception that everyone in Northern Virginia is affluent because we have a high median income. But there are hundreds of thousands of hardworking Northern Virginians struggling to make ends meet, struggling to afford housing, struggling to afford health care. And the big ugly bill and the Republican assault on health care is going to make that struggle even more difficult for them. There are 68,000 folks on Medicaid here in Virginia's 11th district, 9% of our total population. I was at a restaurant last night and a gentleman came up to me, works in construction, works hard every day, and is on Medicaid and fears he will lose his Medicaid because of the cuts in the big ugly bill. And I hear those stories every single day. And final point I'll make with respect to the Affordable Care Act exchanges, and I think one of the benefits that is not discussed enough is the benefit of the exchanges to entrepreneurs and folks who are self-employed. By some estimates, 25% of folks who are on the Affordable Care Act exchanges are self-employed. And for many of them, it's the existence of the exchanges and the affordability of the insurance on the exchanges that has allowed them to take that leap to start a business. And that's something I hear my Republican colleagues talk about a lot, something they say we should be encouraging entrepreneurship and business creation in this country. Well, if you take away affordable health care on the exchanges, millions of Americans who would like to start their own business will no longer be able to do it. And by the way, some folks who have a small business today who are doing the hardest thing you can do, get a small business off the ground, they're learning that they might not be able to afford to keep that business going because of the Republican assault on healthcare and Republicans' refusal to address the looming skyrocketing cost of their premiums. So I want to thank Protect Our Care Virginia for bringing us together today to address this really, really important issue, and my colleagues for their great advocacy.
Thank you so much, Congressman. And that's the perfect transition to actually have a small business owner speaking about what those premium tax credits mean for him and his business. Mr. Johnson.
Good morning, everybody. Thank you for inviting me to join today. My name is Lester Johnson, and I am an entrepreneur as well as a local restaurant owner in Richmond, Virginia. I'm here today to call on Congress to make the enhanced premium tax credits permanent, as many in the hospitality industry like myself rely on these credits to stay healthy and insured. Before the Affordable Care Act, it was hard for small business owners and self-employed people to get health insurance. But this law has been a much needed resource to me and my employees. I was able to sign up for a plan, and I have employees who are able to get their insurance through the marketplace as well. Premiums have been affordable for me as well as my staff. Thanks to these plans, we have been able to get coverage for preventative care and regular doctor's visits. We also have coverage for pre-existing conditions. Restaurants operate on very slim margins, and most owners don't get rich in this business. We do it because we are passionate about preparing food and creating a space for our community to come and enjoy a meal with their friends and family. Having access to good health care gives my employees and I the peace of mind we need to focus on the work we love. I'm very worried about what will happen to me, to my business, and to my employees if these tax credits go away. A few days ago, I pulled up my own personal insurance statement to review, and my premium would actually double in size if not for these credits. That would put a huge financial burden on me and my family. We do not want to have to come back and keep fighting this fight every year, so please make these tax credits permanent to give small businesses and working people one less thing to worry about. Times are already tough, and we cannot afford to lose our health care. I also want to thank my Congresswoman, Jennifer McClellan, for co-sponsoring that bill that will permanently extend these tax credits. Thank you, and God bless.
Didn't unmute myself. Thank you so much, Mr. Johnson, for sharing your story and just the importance of these tax credits to entrepreneurs, our small business owners, our self-employed folks like my uncle who's an electrician, depending on these tax credits. I think everybody said everything that there is to be said in terms of both the enhanced premium tax credit fight, as well as putting that within the broader landscape of the Republican attacks on healthcare from every angle. So with that, I think we're going to open it up for some Q&A from press, which my friend Rachel will moderate.
Thank you, Katie, and thank you everybody for joining us today. We really appreciate it. For our members of the press who are on today, if you have any questions for our particular speakers, please, I welcome you to drop those in the Q&A box at the bottom of your screen. I'm seeing some people have already done so, which is great. And if you have a question for a particular speaker, please note that in your question. And if at the beginning of your question, you could also just type your name and outlet as well, that would be great. Thank you. One moment, apologies. So sorry. Okay, our first question is for Bobby Scott. And that is, can the Virginia surplus of 4B cover the cost of healthcare in Virginia, and for how long?
That would be a question for the state government in responding to the damage inflicted upon Virginia residents by the big ugly bill. We have a surplus, but surplus is a temporary situation. Using a surplus for ongoing costs is not it's not a sustainable strategy. The federal government needs to extend the tax cuts and not inflict that challenge to the state government.
So
But temporarily, that would be one possibility. The Commonwealth has a lot of challenges, and the challenge inflicted by this bill will be one of them. You've got housing, nutrition, everything else, education. There are a lot of challenges addressing the state government. They shouldn't have to pay for a challenge inflicted by this legislation.
I'd like to follow up on that. The answer is no, it's not enough. And Bobby, Congressman Scott alluded to it. In addition to the hole in the state budget that the Medicaid cuts are going to blow, it also, for the first time ever, requires states to not only contribute to the cost of administering SNAP, but to also pay for some of the benefits. And when you combine that with all of the other federal funding cuts, which have disproportionately hit Virginia, with the firing of the decimation of the federal workforce, which has disproportionately impacted Virginia, there's no way that Virginia can fill the budget, the hole left in the budget by all of the actions of the Trump administration and congressional Republicans, and what is going to happen when the number of uninsured people increase. You throw on top of that the tariffs. Our ag industry is being decimated. The healthcare industry is being decimated. Our education infrastructure is being decimated, and the federal government is leaving a hole in the state budget that the next General Assembly in January and our local governments are going to have to make very difficult decisions about whether to cut services and raise taxes. And that's what the Republicans don't want to talk about. They claim that their bill is a tax cut for the middle class, but it's not. All it is doing is shifting federal investment from the bottom 10% of earners to the top 10% of earners who don't need another tax cut. And in the process, it's going to force states and local governments to either raise taxes or cut services dramatically.
Thank you, Congresswoman McClellan. We next have a question for Congressman Don Beyer. And that is from Lauren Burke. And she says, can you talk more about the red areas where healthcare centers are shut down? Are you talking to them? And can they be assisted by the rainy day fund if Spanberger becomes governor?
Yeah, thanks, Rachel. Thanks, Lauren, for the question. Yes, I am talking to them. I'm sure all my fellow Democratic friends on the call are talking to them too, because they come see us. Recently had healthcare centers from Winchester, from Harrisonburg, from Roanoke, from down in Christiansburg, all the way down to far Southwest Virginia, all up and down the Shenandoah Valley, come in to specifically, and they came with Northern Virginia centers too, with Inova, for example, Virginia Health Center. And basically they said, with the health cuts that are coming, the only ones that can survive are the really big ones like Inova, the ones that are national. And we're seeing the first three close already. So yeah, we need to stay close to them. They're our Virginians, even if we don't directly represent them in our congressional districts. And let me just refer to Congresswoman McClellan's very appropriate comments about, can a rainy day fund with Governor Spanberger fix it? No, because there's just so many other ways that they've just destroyed us. Here in Northern Virginia, we're bearing the brunt of the federal government shutdown. And there's just the impact on unemployment insurance alone is significant. But you're seeing slowdowns everywhere. And that's also going to mean that, I've been doing state government long enough, not as long as Bobby Scott, but there are times when we have surpluses and times when we have deficits, and they tend to switch pretty quickly. and we could go from a surplus to a deficit in 2 years with the snap of fingers, Donald Trump's fingers.
Could I add one thing? Then that is, when you close a rural hospital, the next hospital may be hours away. And so if you have an acute problem, a stroke, an automobile accident, you're on the road for an additional hour or so, sometimes more than that, getting to the nearest hospital because the hospital closed. This will have a devastating impact on the quality of healthcare in rural areas.
Thank you, Congressman Scott. Next, we have another question for you, Congressman Scott, and that is from Brad Kuttner. And that is, Representative Kiggins says that she is pushing for a temporary tax credit to give Congress more time to figure out how to fix these cuts. Would you support such an effort?
Well, I think, first of all, the problem was created by the failure to include them in the big ugly bill. So, that's where the problem was caused. And to have a one-year solution, you can't ignore the fact that that gets you past the midterms. The Medicaid cuts don't come in until after the midterm elections. And to postpone the pain until after the midterms does not solve the problem. It just protects people from the immediate aftermath of their of inflicting this damage on the American people. Obviously, a one-year extension is better than nothing, but you cannot ignore that the major impact of that would be to get you past the midterms, and I think that's what you have to consider. And I'd defer to Jennifer. I think she has a comment.
Yeah, a year is just not enough. I think Lester would agree, and most people, especially our small business owners, they need to plan. And the uncertainty created by the Trump administration and the chaos, whether it's through the tariffs, whether it's through funding that Congress appropriated that the administration froze, whether it's trying to make plans for open enrollment and healthcare, this constant kicking the can down the road just puts that much more stress on people, families, and particularly small businesses. And a one-year extension is just not enough. And this Congress, whether it's through funding bills, or this latest attempt to just kick the can down the road again, we are making it very difficult for people to just plan and have some security. And the one area you don't want uncertainty around is whether or not you'll have health insurance. And so it's 1 year extension is just a gimmick because, Republicans know they have a problem, but they can't figure out how to solve it. And the way to solve it is to make these tax cuts or tax credits permanent.
And we know what the problem is. It's extending the tax credits. We're not going to know anything more next year than we know now. So we might as well deal with it.
Can I just add to that? And I haven't had the opportunity yet to meet Representative Kiggins, but I think one of the things that is outrageous about the suggestion of temporarily extending support for healthcare is that anyone who voted for the big ugly bill voted to permanently extend tax cuts, the vast majority of which go to the wealthiest Americans. And I think it highlights where the priorities are for this Republican Congress and for Congresswoman Kiggins. So if you're someone who makes millions of dollars a year, your tax cuts are permanent. But if you're a small business owner or a working person who needs these premium tax credits to afford health care, they're only willing to consider a temporary extension.
Thank you, Congressman Walkinshaw and Congresswoman McClellan. We next have a question from Michael O'Connor. And this question is, could you please put this issue in the context of the federal funding talks right now and the potential for a shutdown? Are you willing to shut the government down if Republicans don't compromise on this issue?
I'll start with that. First of all, we're not in charge. Donald Trump and Republicans control the White House, the administration, and Congress. And from day one of this administration, Democrats in the House and the Senate have stood ready to negotiate a budget bill that takes care of the needs of the American people, whether it's health care, whether it's lowering costs. We stood ready to do that from day one, like we did last year, most recently in December. And Republicans made clear from day one they didn't need or want our help. They cut us out of the process for the March extending bill. They cut us out of the process for the one big ugly bill, and they're cutting us out of the process right now. And so if there is a government shutdown, Donald Trump and the Republicans own that. Now, again, we stand ready to pass a funding bill that meets the needs of the American people. And what we are hearing loud and clear all over Virginia is that Virginians are worried about access to health care and lowering costs. And the budget bill that Republicans passed in March doesn't do that. The big ugly bill doesn't do that. And I'll remind you that the resolution that the House jammed through last week failed in the Senate on a 44-47 vote. So they couldn't even get enough Republicans to vote for it. So they want to say if there's a shutdown, it's Democrats' fault, but the blame lays squarely at their feet. And we are continuing to put forward plans that will address the healthcare needs of the American people.
And I think you really have to remind yourselves how we got in this mess to begin with. They cut taxes $4.5 trillion and then used healthcare cuts to try to offset some of that. They couldn't. They still ended up with $3.4 trillion in new debt. But they have a situation where the tax cuts put us in heavily weighted to the wealthy, put us in the mess we're in, and they're trying to cut health care to pay for those tax cuts. I haven't heard any of them suggest, well, maybe if we didn't cut tax cuts as much, we could have afforded to extend, we wouldn't have had to cut Medicaid, and we could extend the Affordable Care Act tax support. That's how we got here.
Thank you, Congressman Scott. We have an additional question for you, if you're able to answer for us, and that is from Lauren Burke. And what is the timing for when constituents find out when their healthcare costs will change? Are you hearing from worried constituents about healthcare concerns?
The bills go out, I believe, November 1st, and that's when people will find out that most of them, the increase will be about 15%. A lot of them, as Mr. Johnson's bills, will probably double. One of the things we did was eliminated the so-called cliff. We give benefits up to 4 times poverty, which for a family of 4 is a little over $100,000, but for a single person is only about $50,000 or $60,000. Over that, you get no help. We extended you pay 7.5% of your income to health care. We extended that to everybody, even those over the cliff. At some point, the 7.5% will cover the sticker price. But once you eliminate all that support, you're back to at $60,000 or so, you get no help. So if you got an $8,000 policy and you were paying, $4,000 for it, it could double. Someone right over $100,000 family policy could cost $15,000. You're only paying $8,500. And that's when the people say that their premiums will double. That's what they're talking about, those right over the cliff. But everybody will go from about 7.5% to 8.5% of their income, way over more than 10% increase in their premiums. And those bills will come out around November 1st. And if we can get this thing fixed well before that, people will not have to be shocked. And when they see those, you heard Laura say that she's sick, she has to pay the bill. Well, a lot of people will decide, no, they can't pay the bill. And they have one thing in common. They're all healthy. And so the insurance pool will be sicker and everybody's premiums, the sticker price for everybody's premiums will have to go up.
All right. So thank you, everybody. I think the outstanding questions were on the Congresswoman Kiggins bill, which folks already addressed. So I want to thank all our members of Congress for being such champions of healthcare, and thank you for fighting to get those premium tax credits renewed, because I know my family's counting on it too. Thank you all.